Hello and welcome back to Twin Watch 7777. All right, so I want to make sure I got three sevens. Twin Watch 777. Okay, so today we're going to be talking about measles. And according to this article in the ABC News by Mary Kakatos, she said at least 171 measles cases confirmed in 9 states, according to the CVC. So I'm going to be jumping from about three different sources, and then I'm going to also show you some videos. So we're going to start over here with this ABC News report, and we're going to start with the video. So I guess he's just going to say the same thing that's written down here in this article. So I'm going to read just a couple uh, sentences from here. And it says at least 171 measles cases have been confirmed in the U.S. so far this year, according to a newly updated data from the CDC and prevention. Cases have been confirmed in 9 states, including Arizona, Florida, Georgia, North Carolina, Ohio, Oregon, South Carolina, especially South Carolina. I wonder what's going on down there in South Carolina, Utah, and Virginia. At least one state, South Carolina, has been facing measles outbreaks since early October. Wonder why? With the majority of cases in Spartanburg County, which borders North Carolina. And then it goes on to say at least 124 new measles cases have been reported in the state since last Friday, health officials announced earlier this week. So I am going to go ahead and play this video and see what he has to say.
Measles is escalating in terms of severity and in terms of infections throughout the entire United States. Measles is one of the most infective viruses known to man, and one person can infect 12 to 18 people. Contrast that, one person with the flu can infect up to 3 people, and so measles can infect almost 4 times as many people as the flu.
This virus is very hardy and can be in tiny droplets in the atmosphere. The measles virus can linger in the atmosphere, sometimes for a couple of hours or more, even after someone's left the room. So each place that individual went, you had to worry that he or she left a trail of virus in the atmospheres.
The measles virus, being one of the most infective viruses that we know about, can infect both those who are vaccinated and those who are unvaccinated. And the way I'll describe it is, think of the measles virus as an enemy firing arrows at you. And the vaccine, if you have it, is a shield in front of you. If you're protected and you have that vaccine, you have a shield in front of you. And if something were to get past that shield, it may infect you, but it's less severe. And so individuals who are present, who have measles vaccine, can still be infected. However, just like the flu, their symptoms and their duration of illness is much less.
20% of kids are hospitalized. 1 in 5 kids who get measles are hospitalized. 1 in 20 children who contract measles get pneumonia, which is the most common cause of death. And 1 out of 10 can get measles ear infection with permanent hearing loss.
Vaccines are the number one thing we can do as a proactive nature and a proactive measure to protect ourselves, our families, and our communities. So the onus is really on us as physicians and healthcare clinicians to have good, honest conversations with our families and our parents, discussing all of the positive things with vaccines, hearing them, understanding their concerns, but still providing that proactive nature.
Wow, that's interesting, y'all. And
Well, the FBI is investigating the death of former Colts owner.
Okay, that's something else. So I'm going to close that, and we're going to go over here. Um, I didn't even fix that, but I think y'all can see the video. Hold on, I don't think y'all can see the video. Let me straighten this out real quick. Okay, I'm trying to straighten this out so that um, we can watch it, the whole video on the screen. Okay, so this is where the CDC panel votes to push back the MMRV vaccine recommendations to 4 years old. But before that, there's something I wanted. Okay, yeah, this here. I wanted to um, read this. And I'm going to try to make this larger so that we can see it on the screen here. Because I'm also want to look up some images of what the measles look like, because I never seen measles in real life. And why can't I? Come on now. I'm trying to fix this here. Is it frozen? I think okay. I thought it was frozen. Okay, I think I have it. So this is the measles vaccine, and this was dated for everyone on January the 17th of 2025. And these are the key points here. Let me put it over there. Okay, so you get 2 doses of the MMR vaccine, and it's recommended by doctors as the best way to protect against measles, mumps, and rubella. And children may get 2 doses of MMRV vaccine instead. So the MMR and the MMRV vaccines usually protect people for life against measles and rubella, but immunity against mumps may decrease over time. So I wanted to go over that. Now let's go back to the CDC and see what's going on and with the CDC. So, all right. So I think I have that where we can all see the video. I like to make it bigger. See if I can make that a little bigger here. Okay. Make sure we can see it. I'm just getting used to doing all this. So, y'all, thank you for bearing with me. I'm learning. I'm getting there. Okay, so I think I have it. Oh, it's blocking me. What am I doing now? It's blocking me. Okay. All right. So, okay. All right. So let me. Okay, y'all. Let's get it.
Fired CDC Director Susan Monterez is exposing her clashes with RFK Jr. over vaccines. Monterez was fired just 29 days into her tenure. She says she was ousted because she refused to follow Health Secretary Kennedy's demands. One of those demands, she says, was to fire career scientists. She says the other demand was to pre-approve vaccine recommendations from a committee that included anti-vaccine activists. She testified on Capitol Hill today that she couldn't pre-approve recommendations without first reviewing the evidence. Senator Bill Cassidy, a Republican from Louisiana, asked Monterez today whether RFK Jr. instructed her to change childhood vaccine recommendations without science or data. Monterez responded, correct. Senator Lisa Murkowski, a Republican from Alaska, asked Monterez and the CDC's ex-chief medical officer, Deborah Oury, whether there are any career scientists left at the CDC. Oury said, no, there aren't any career scientists left in the director's office, which is the agency's top level. That means it's entirely comprised of political appointees. When Monterez was fired last month, several top CDC officials then abruptly quit. Plus, hundreds of CDC employees protested to show their support for her. Kennedy defended his decision to fire her, arguing she wasn't trustworthy. I'm Kate Martell, and I write the Hill's 1230 Report newsletter.
He mean that she wasn't going to bend down and hello, kisses. Is this still on? And kisses, behind. So there's no scientist at all in the CDC. All political appointees and directives. All right. So I am going to read a little. I was going to play this. I don't want to read this because this is a lengthy article. here, but I'm going to read maybe the first paragraph. And the Vaccine Advisory Panel for the CDC Control and Convention voted Thursday in favor of delaying the administration of the vaccines for measles, mumps, and rubella and varicella, which is chicken pox, commonly known called the MMR. Okay, so I'm going to switch over here because I want to talk to you a little bit about what it looks like, because I never seen. I want to see an image of measles, so I'm going to try to find measles and mumps. Let me see, measles and mumps images. I want to see if I can find some images so I can get a look to see what it looked like. All right, so I see the vaccine and I don't see really any images, good images that I can, they don't have no images here? Oh, okay, here's one image. Let me see. Let me put it over here, y'all. Here goes some, a child. Okay, so this here is a child with, where's my mouse? I lost my mouse. Okay, there it go. All right, so this here is the image of a child with measles, and this was taken like 3 years ago. So that's what it looks like. Okay, then the symptoms of measles is runny nose, cough, tiredness or sleepiness, loss of appetite, fever, sensitivity to light, spots inside the mouth, and conjunctivitis. Conjunctivitis is a medical term for pink eye. Okay, here's the measles in babies right there. So that's how the measles look like in a baby. Okay, I don't know what that is. And what is this? This is the measles. Okay, so there. So far, this has been the best picture that I've come across. So that's what measles look like. Okay, so now I came across a video on YouTube where what's his name? David Parkman, the David Parkman show, speaking about it. So I am going to flip over here and we're going to check out his video.
We have a story that we have been covering, but is mostly flying under the radar, and it really shouldn't be. And it is the story of a growing measles outbreak in the United States, an accelerating measles outbreak in the United States. In South Carolina alone, officials are now confirming 88 new cases. This brings the total to 646 cases of measles. Hundreds of people are under quarantine. Schools and colleges are affected. Grocery stores have become exposure sites. And this is not isolated because the United States is now
Not
1 year
only,
into...
I would say not only grocery stores, I would say maybe any public area where there's a congestion of people, like public transportation, churches, and like you said, grocery stores and schools, school buses, you know.
To continuous measles transmission. If that continues, the United States risks losing measles elimination status, which was achieved in the year 2000, which would mean that measles is no longer a rare import. It would be endemic again, constantly circulating like it was decades ago. This is a disease we had defeated, and it is coming back to life. Here's CNN with just like a brief note about this.
Today marks 1 year since the start of the measles outbreak in West Texas. And a year on, measles cases are still surging across the country, with new cases reported every week since then. At least 171 measles cases in just the first 2 weeks of this year reported, which is nearly as many as the average annual total in the 25 years since measles was declared eliminated in the U.S. Over the weekend, Clemson University in South Carolina saw its first case. The university says that that person has been isolated and they're now doing contact tracing to determine who else was exposed. South Carolina has reported 558 cases, and nearly half of them reported in just the last week.
All right. So last year, the U.S. recorded more than 2,200 measles cases. That's the highest since 1992, 33 years ago. 2 kids died in Texas. 3 people died nationally. That is as many deaths as the previous 25 years combined. So far this year, in just the first 2 weeks of January, 171 cases in 9 states. And the key fact, okay, think carefully about this one. More than 95% of cases are in unvaccinated people. Measles is one of the most contagious viruses known. If you're unvaccinated and exposed, the odds are really high that you get it. And that brings us to an uncomfortable truth. What the United States is dealing with right now is optional. Measles vaccination has also become effectively optional. Let me explain. Schools require it on paper, but exemptions are unfortunately too easy to get in a lot of states. If there's a state that has a religious exemption, you can basically get it. You could just say, here, this is what my religion teaches me, or it's based on my religion. You don't even have to justify the teachings or the sacred text. The sacred text, anybody can just generate a sacred text. What does that even really mean? Philosophical exemptions exist, paperwork
Sacred
loopholes
text,
exist,
what?
and the predictable result is an undervaccinated population in certain pockets by choice, not by accident. And measles immediately exploits that. Before the vaccine, measles infected a lot of people every year, and it caused a lot of deaths, and it caused even more hospitalizations, and it caused even more permanent complications like brain damage and hearing loss. And that's why the vaccine was this huge triumph. And after widespread vaccination, cases collapsed. By 2000, we considered it eliminated in the United States.
Eradicated.
What changed wasn't the virus, it was the vaccination. And the MMR vaccine is not a new thing. It's not experimental. It's been used for decades. 1 dose, 93% effective at preventing measles. 2 doses, 97% effective at preventing measles. Serious side effects, very rare, way rarer than measles itself. And the consensus under Trump and under Bobby has been eroded. Trump spent years flirting with anti-vaccine rhetoric. Long before COVID, he amplified junk science about autism and vaccines and treated vaccine skepticism as a legitimate debate and elevated people like Bobby and others who undermine childhood vaccination. And even with
that is just very mind-boggling. Bobby in there, he doesn't have a medical background. He doesn't know what he's doing. He didn't fire all the CDC career staff, and it got political people. What? Oh man, this is dangerous.
without banning the vaccine, we see the damage is very real. And we have a president that has turned public health into a culture war. I recently had a conversation with our pediatrician because we're going to be doing some international travel to Europe soon. I mentioned this thing I'm going to be doing in Portugal. And our pediatrician said, listen, quite frankly, without getting very political, I think the baby can't get the MMR yet. She's too little. And the pediatrician said, I would be more worried if you were going to Texas or, you know, this part of South Carolina, that's a problem, or I would be more worried if you were going there than going to Europe. And in fact, I looked at the measles vaccination rate in Portugal, and it is higher than the average in the United States. The blue states have a very high measles vaccination rate. So it's similar to just being in the state of New York or the state of California or the state of Massachusetts, Connecticut, et cetera. But that's a recommendation from a pediatrician, which is I'm less worried about you going to Portugal. Everybody in Portugal is vaccinated, not so much in some of these anti-vax enclaves. So we'll see if the United States loses its measles elimination status, but that kind of misses the point because we have a deeper problem here, which is that a country with massive resources, we don't. There's no pressure for us to have measles here. We are failing in basic public health. We have the tools, we have the money, but for political reasons, a bunch of people have been convinced, don't use the tools that we have. So the outbreak didn't have to happen. It's not a scientific mystery why it's happening. There's no technological hurdle. We have leadership that isn't willing to say, hey, the vaccines save lives. You should do what has been recommended medically for a really long time. Safe vaccine, effective vaccine. And then they are pretending that not doing that doesn't have consequences. We are seeing the consequences. It's optional. It's disgusting. It's terrible. Staying focused while you work can be difficult.
That's crazy. Okay, so shout out to again David, was that Pacman? That Pacman show. I'm sorry if I said Parker the first time, but it's the David Pacman show. So shout out to him. I want to look and see what is the recommendation. Okay, here we go. Recommendation. All right, here we are right here. All right, so I pulled up the recommendation over here. So both the and can y'all, do I have it in there? All right, both the MMR and the MMRV vaccines may be given at the same time as other vaccines. Your healthcare provider can give you more information about each and which to get. Now, the MMR, children need 2 doses of MMR vaccines at 15 months, 12 to 15 months old, the first dose, and the second dose would be between the ages of 4 and 6. Now, I am not a doctor, so it is best to talk to your pediatrician, your physician about the MMR and the MMRV. But I am just reading this, and I got this information from the CDC website. This is where I got this from. And going on, it says older children, adults, adolescents, and adults also need 1 or 2 doses of MMR vaccine if they don't have evidence of immunity. I don't remember getting my vaccine, but I still have the mark all those years ago, and I'm almost 60 years old, and that mark is still there. So whatever needle they used must have been a doozy. Doses should be separated at least 28 days apart. If anyone have been vaccinated and you still have your vaccination mark, put it in the comments and let me know that, yeah, still there. Anyone traveling internationally should be fully vaccinated before traveling. Infants 6 to 11 months old should get 1 dose of the MMR vaccine before travel. Then they should get 2 more doses after their first birthday. Now, people at increased risk for mumps during a mumps outbreak, an additional dose of MMR may be needed. Public health authorities will notify you if you are at an increased risk and should receive this extra dose. If you already have 2 doses of the MMR, it's not necessary to seek out vaccination unless the authorities tell you that you are part of the group. And so I will put the link to the CDC where I got this information from. I will definitely put it in my description. So I wasn't planning on reading this, but I'm going to read it. Looks like they got some pretty good information here to read through. Oh, wow, that's a lot. Okay, so where are we? All right. Okay. This looks like some really good information. I'm going to read this. After exposure to measles, mumps, or rubella, if you don't have an immunity against these diseases and become exposed to them, talk with your doctor about getting the MMR vaccine. It is not harmful to get MMR vaccine after being exposed to measles. That's what I was wondering. Okay, mumps or rubella. Doing so may possibly prevent a later disease. If you get an MMR excuse me, if you get an MMR vaccine within 72 hours of initially being exposed to measles, you may get some protection or have milder symptoms. In other cases, you may be given a medicine called immunoglobulin IG within 6 days of being exposed to measles. This provides some protection against the disease or illness is milder. Unlike with measles, MMR has not been shown to be effective at preventing mumps or rubella in people already getting infected. So why getting vaccinated is important. The MMR vaccine protects your child from measles, mumps, and rubella, potentially serious diseases caused by viruses. Almost everyone who has not had the MMR vaccine will get sick if they are exposed to these viruses. The vaccine keeps your child from missing school or child care and you from missing work to care for your sick child. Vaccinations also limits the size, duration, and spread of the outbreak. So yeah, like I said, it looks like some very good information on here. And it also says right here who shouldn't get vaccinated. Some people should not get the MMR vaccine, or they should wait. People should check with their healthcare provider about whether or not they should get the vaccine. All right, so if you have an allergic reaction, if you're pregnant, a weakened immune system, or have a condition that you bruise or bleed easily, TB, gotten, okay, yeah. All right, so I will definitely put the link to the CDC website where I acquired this information that I just read to you. And again, it is best to consult your physician, your pediatrician, if you are considering or you are curious about the MMR or the MMRV vaccine. So it's always good to consult with a healthcare provider, your PCP, and such as that. So that here is the end of my video, and thank you for watching. And shout out to my new subscribers. I was so happy. I'm so happy that I'm getting some new subscribers. It just encouraged me to keep going. And like I said, this is like I had this channel up for a while now, but I'm just now starting to upload videos and getting used to, talking and giving my opinion and everything. So yeah, now appreciate you. I just want you to know that. Okay, so yeah, I will see you. Thank you again, and I will see you in my next video. Y'all be blessed, and I'm out now.